To start with, migraine is a very complex clinical condition with 1 billion sufferers and more than 200,000 attacks a day in England. Um, it is a very difficult problem to manage, and it's a multifaceted, multifactorial, and cannabis-based medicine or the cannabinoids are helpful because they are an anticonvulsant, an antiemetic, a painkiller, and an anti-inflammatory. And all those features are at the core of the um, pathophysiology and the genesis of migraine and migrainous attack. And that's why it was a no-brainer to consider trialing those new medication in patient with resistant migraine problem. And here was the good outcome. Cannabis-based medicine work at a multiple level in the pathogenesis process of the migrainous attack. It works at the trigeminal level, at the dural level, and at the mast cell level, and it counteracts what we call the neurogenic inflammation that happens and predispose to the migrainous attack. The CB1 and CB2, which are the receptors where cannabis-based medication work, have an impact on reducing the inflammatory mediators, reducing the electrical stimulation and excitability of the nerve cells, reducing and stabilizing the mast cell, which is the pro-inflammatory cell in the central nervous system, and even the suggestions that it's got some effect on what we call them the microglial cells, the cells in support of the neurons in the nervous system. And collectively, it lends itself heavily to be effective in the prevention and the management of migrainous attacks. Cannabis-based medication, like any other group of medicines, come with side effects and come with potential problems. The commonest being having some impact on the level of concentration in some patients. However, when compared to the drugs that we are using in mainstream medicine, like opioids, they are much less sedative than opioids. They can have an impact in the long-term use on having some tolerance to those medications, but again, it's a much less impact on tolerance compared to the mainstream medications that we're using, namely the opioids. So despite it having potential side effects, its side effects profile is much better than the drugs that we already use. In general, we do not have clear evidence on the impact of cannabis on the newly born fetus. So pregnancy is a contraindication because we don't know what could happen in the future, and therefore we're not going to take that risk. Another group of patients are those who are having a growing and maturating central nervous system. I mean kids and growing young adults. It is to be avoided if possible in those patients because again we don't know its impact on the maturation and growing of the central nervous system, and that can be a problem. Therefore, we try and avoid using it in anyone below the age of 25. And the third group that is to be careful with are those who have a history of psychosis or family history of psychosis. And in those patients, it may have a negative impact in predisposing certain types of psychosis in those who are susceptible to it. So when we prescribe, we check that the patient is not pregnant and not going to try for a baby in the near future. Of course, the age of the patient, it needs to be above 25. However, it's been licensed for kids with some resistant types of epilepsy. But then it's a pros and cons judgment by the physician to whether to give those drugs and stop the life-threatening epilepsy, or to take that risk of affecting neuronal maturation. And we would avoid using them in people with psychosis or family history of active psychosis.